Hi, I'm Dr. Ron Receveur. I've been a dentist in New Albany, Indiana for over 30 years. You see, I've always had a genuine passion for the dentistry that I do. I was born with a partial cleft palate and spent many hours in a dental chair as a child. Those experiences weren't always pleasant. I learned at an early age what it was like to be self-conscious about my appearance too. And I wanted to become a dentist to change those experiences for my patients. I've always felt that the best doctor had been a patient. I felt like that taught him compassion and sensitivity. Because of my experiences as a child, I've always had a real passion for what I do, a sensitivity for my patients' needs, and a genuine concern for their comfort. I also learned that I didn't enjoy the many hours I spent in a dental chair. Hi, I'm Dr. Ron Receveur. I've been a dentist in New Albany, Indiana for over 30 years. I've always had a genuine passion for the dentistry that I do. You see, I had a partial cleft palate when I was born. I learned at an early age what it was like to have painful dental experiences and to be ashamed or embarrassed about my appearance. We see patients all the time that come into our office and are embarrassed to smile or uncomfortable with their appearance. And I've learned firsthand what that was all about when I was a child. Dentistry back in those days was painful and uncomfortable, and that's what drove me to want to become a dentist. I wanted to become a dentist to change those kinds of experiences for our patients. I've always felt like the best doctor had been a patient because I felt like he was more compassionate and sensitive to his patients' needs after having been through those experiences. I didn't enjoy going to the dentist as a child because it was painful and the doctor didn't have the kind of sensitivity that I thought he should. He didn't care about my comfort a great deal. I wanted to become a dentist to change those experiences for my patients so that they didn't have to go through the painful dental procedures and they had predictability with getting a nice smile and the type of dentistry that we can offer them today. Now, I was very self-conscious about my appearance when I was a child. My smile wasn't what I wanted it to be, and my teeth were unattractive. And so when patients come in and they tell me that they're embarrassed about their smile, I connect with them. I understand how they feel when they tell me that they're ashamed to smile. I've seen doctors go through cancer therapy and other types of medical treatments in addition to dentistry, and I've talked to them and they've told me how they were enlightened. They were surprised by being on the other side of the relationship. They were surprised how that felt to them, and that they were more compassionate and sensitive to their patients after having gone through that treatment. There's no doubt that my going through all those experiences affected me, not just as a person, but as a dentist, because now when I sit down with a patient and that patient is very scared or they're ashamed to admit, some people don't like to admit that they're embarrassed of their smile, with their smile or with their appearance. You get a female that her appearance and her smile is wrapped up in what she considers to be her attractiveness or her overall appearance. That's a real sensitive issue, and I think I understand it pretty well. I let my patients know that many of the procedures that they're going to have, I've already had myself, and I know how it feels in my mouth. I know how injections and surgery and the noises and the sounds. I understand how all those feel in my mouth. I laugh with quite a few of my patients and say, I've had more dentistry than you'll ever have. And they look at me kind of funny, like I'm pulling their leg or something. And I say, I'm serious. I've had more dentistry than you'll ever need. And so from personal experience, I can tell you how this is going to go and how it's going to be. To help our patients overcome their fears and their phobias, we have numerous options to ensure their comfort and give them the type of dentistry and smile that they're looking for. We offer IV sedation, where we can accomplish all of their dentistry frequently in 1 or 2 visits. Patients love the IV sedation because they wake up and don't remember being in the chair. It's amazing to me how many people have their eyes light up when they realize that they can be sedated and won't remember having anything done. I wished I could have had IV sedation when I was a kid. It would have it probably would have changed my life, or definitely all my dental experiences. Because of my experiences as a child, I've always had a real passion for what I do, a sensitivity for my patients' needs, and a genuine concern for their comfort. Hi, I'm Dr. Ron Receveur. I've been a dentist in New Albany, Indiana for over 30 years. I spent many hours in a dental chair when I was a kid because I was born with a partial cleft palate. I learned what it was like to have painful dental experiences and be self-conscious about my appearance. It's the reason that I decided to become a dentist when I was in high school. It was a very traumatic experience going through all the things that I did, and I wanted to become a dentist to change those experiences for my patients. Hi, I'm Dr. Ron Receveur. I've been a dentist in New Albany, Indiana for over 30 years. I've always had a genuine passion for the dentistry that I do. You see, I had a cleft palate when I was born, and I learned at an early age what it was like to have painful dental experiences in the dental chair, and what it was like to be ashamed and embarrassed about my smile and my overall appearance. I learned that I didn't enjoy the many hours I spent in the chair, and I decided that I wanted to become a dentist to change those experiences for my patients. I always felt like the best doctor had been a patient and knew what it was like to deal with those emotions and those pains. So I set out to become a dentist and change all those experiences for the patients that I treated.